I was hoping you could kind of talk more about what your hopes are for the future of telehealth.
Well, my main hope is that we're able to set up some kind of infrastructure in this country so we can get the access to everyone else. Like I said, those 40 million households, when I saw that number, it's like, wait a second, we're the United States of America. How are that many people still without internet and able to high-speed internet to be able to even conduct a telehealth visit? It's going to be at the combination. Number one, the government, of course, is going to have to step in, but I think it's going to have to be a combination with this private sector also. These facilities, these communities of color, um, part of the problem is they don't even have the infrastructure in these facilities because they know there's not as much money there to pay for it. So the companies say, oh, well, why should we build this if they're not going to be able to pay for the service? So it's going to have to be a combination of both the government and the private sector, really focus on trying to get this infrastructure built so we can at least have the ability to offer this telehealth. Find some way of paying for this just as an option, even if it means just having them internet action that access is just for a school or for healthcare or anything like that, set up certain portals, anything, but we have to be able to expand this telehealth. Like I said, with the mental health process of it, this can be leaps and bounds. Releasing because it's a shame with the stigma, but I understand the stigma. Myself, I was in therapy for over a year before I told anyone I was taking therapy. So this is a way you can be in therapy and not tell a soul. No, I will know if you feel comfortable like that. But we have to also set up a system where once we do get everything rolling, we get the infrastructure going and things, we have to set up a system where we can do like testing out before the appointment, like maybe a 48 to 72 hour test, because a lot of these devices and this internet, it's going to be new to a lot of individuals. So you can't, it's not enough just to build everything, say, okay, here you go. We're going to have to teach them how to use the equipment. And if you like get that text message saying, hey, you're ready for your appointment, you click on, next thing you know, you got to download this video, you got to do different things. Excuse me. You're not going to know what to do exactly. And if it's time for your appointment, you're finding out right then, you're like, oh no, I can't do this. I got to download this. Or one of the problems we had was if you use your phone, your smartphone to do it, you have to download a third-party app for the video program and things like that. And people didn't feel comfortable giving their permissions to this app. So by the time they went through all that, they had to reschedule their appointment. So something we do is like sending out something 48 to 72 hours ahead of the appointment, say, all right, click here. If you click through here and you're able to get to this page, that means everything's fine. So you're good to go on the day when it's time for your appointment. It's little things like that. It's going to take people actually sitting down and collaborating to figure out how we can get this to everyone, and not only how to get to it, how to make it feasible for them to use, user-friendly. And that's my biggest hope, because like I said, I feel so blessed to be able to have this opportunity to do it, but it's something I completely took for granted, just like other aspects of my healthcare, with my battle with cancer and through my hip replacements and surgeries. It's something I took for granted, being able to have access to this. And it's something I think it's something we definitely have to change in the United States. Everyone should be able to have this. And telehealth is just another aspect of how everyone should have access to healthcare in the United States.